Good afternoon and welcome everyone to the Senate Committee on Health and Human Services for the 83rd Legislative Session. Madam Secretary, please proceed to call the roll.
Senator Lang. Here. Senator Stone. Here. Senator Taylor. Present. Senator Titus. Chair Doniate.
And I'm here. Thank you so much, and everyone here is present. Good afternoon, everyone, and thank you so much for joining us today. Today, we do have a bill hearing on Senate Bill 217. And so we're very excited to welcome folks both here in the overflow room and in Las Vegas. I do have a few housekeeping items for folks as we get started. So main thing is if you wish to testify today, please go ahead and sign in at the table by the door and provide a business card if you do to our committee secretary. If you do not wish to testify, you may want to sign in so that there's a record of who is interested in a particular bill in the event the committee needs to contact you later. When testifying, please turn the microphones on to speak and off to listen. We have listeners both here and in Las Vegas and online, and we are recording this meeting as it will be available on the legislature's website. We ask that public comments be kept to 2 minutes so that everyone interested in speaking can be accommodated and we get through the agenda in a timely fashion, and speakers are urged to avoid repetition of comments made by previous speakers. And lastly, we ask for folks to please turn off their electronic devices, especially cell phones, or put them on silent during this meeting. So at this time, I will go ahead and open the bill hearing on Senate Bill 217. This bill revises provisions relating to reproductive health care, and we're glad to welcome our Majority Leader, Senator Canizaro. Please begin when you're ready.
Good afternoon, Chair Doniate and members of the Health and Human Services Committee. My name is Nicole Canizaro, and I proudly represent Senate District 6 in the northwest portion of the Las Vegas Valley and proudly serve as your majority leader here in the Senate. I am very pleased today to be presenting to you Senate Bill 217, which revises provisions relating to reproductive health care, and alongside Amanda Klein, founder of Nevada Fertility Advocates. Parenthood and the choice of when and how to have a family is a deeply meaningful and life-changing experience for many individuals and couples. I know that I can definitely say that for myself. The ability to build a family is not only a personal milestone, but also a fundamental aspect of human connection, providing love, stability, and for so many, a sense of purpose. However, for millions of people facing infertility or other barriers to conception, the dream of parenthood can feel so very out of reach. In the United States, infertility affects a significant portion of the population. Nearly 10 million women aged 15 through 49 experience impaired fertility, which indicates difficulties in getting pregnant or carrying a pregnancy to term. Among married women aged 15 to 49, 8.5%, so approximately 2.4 million, are infertile, meaning they have been unable to conceive after at least 12 consecutive months of unprotected sexual intercourse or face other diagnoses of infertility. About 9% of men and 11% of women of reproductive age have experienced fertility problems. Advancements in reproductive medicine, including in vitro fertilization, which we will commonly refer to as IVF, and other forms of assisted reproductive technology, which we will refer to as ART, have transformed the way that individuals and couples achieve this dream. These treatments provide hope and opportunity for those struggling with infertility, for same-sex couples who are seeking biological parenthood, for individuals with medical conditions that may affect their fertility, and for those who choose to conceive possibly later in life. Although often successful, these treatments can be very costly, and they often serve as the biggest barrier to fertility preservation. Insurance coverage for these services varies depending on the insurance plan, the state, and other individual circumstances. For example, California, Massachusetts, and New York have enacted legislation requiring certain health insurance plans to cover IVF. In other cases, some insurance health plans may cover just a specific number of assisted reproductive cycles or have a maximum amount that they will cover. Without coverage for these treatments, many parents may not have the opportunity to become just that, parents of a child. So with your permission, Mr. Chair, what I would like to do is conduct a brief section-by-section overview of the bill, and then I would like to turn it over to Amanda Klein to share her story with all of you before proceeding to the end of our presentation. So, for a section-by-section overview of the bill, Sections 2 through 6 make certain definitions and define certain terms relating to assisted reproduction. Section 7 provides that the provisions of this bill apply to all state and local laws and ordinances, regardless of when they were enacted. Section 7 also prohibits government entities from restricting access to assisted reproduction, healthcare providers' ability to offer related services, insurance coverage, or individuals' control over their reproductive genetic material. Section 8 strengthens these protections by prohibiting governmental limitations that specifically target and substantially burden assisted reproduction, related drugs or devices, or healthcare providers offering these services. Section 8 also grants individuals, healthcare providers, and insurers the right to challenge such burdens in court. Additionally, the Attorney General is authorized to intervene against unlawful restrictions on assisted reproduction. Section 9 provides important legal protections for individuals and for entities involved in assisted reproduction. Following the Alabama Supreme Court's February 2024 ruling, the liability concerns for clinics were far-reaching, and I'm sure many of you saw that. And in the absence of Alabama's legislature's swift action, could have severely limited the ability of clinics in Alabama to continue providing services to their patients. Therefore, Section 9 ensures that no person or organization can face civil or criminal liability, disciplinary actions, or administrative sanctions solely for providing or receiving goods or services related to assisted reproduction. This protection also extends to those storing or transporting embryos and manufacturers of reproductive-related goods, shielding them from liability in cases of embryo damage or loss. However, it is important to note that these protections do not apply in cases of negligence, criminal activity, or actions that fall outside of the provider's scope of practice, training, or expertise. Section 10 provides that a fertilized egg or human embryo that exists before implantation into the uterus of a human body is not considered a human being for any purpose under Nevada law. Sections 12, 13, 15, 20, 24, 27 through 29, 32, 36, 38, 42, and 45 all require certain health insurers, including public and private employers who provide insurance to their employees, to provide a special enrollment period to a person determined by a qualified healthcare provider to be pregnant. During this period, the pregnant person must be allowed to enroll in a healthcare plan outside of the period of open enrollment. Sections 12 through 14, 23, 31, 37, 38, and 44 all require Medicaid and public and private health care plans for groups of more than 100 insured individuals to include certain coverage for the treatment of infertility and for the preservation of fertility where the insured has a medical condition or requires medical treatment that may cause infertility under certain circumstances. Section 16 exempts employers who provide benefits for health care for their employees through a self-insured plan from these requirements. Sections 12 through 14, 19, 23, 31, 37, 38, and 44 prohibit an insurer from imposing conditions, including cost sharing, prior authorizations, and waiting periods on infertility treatment or fertility preservation if such conditions are not required for similar benefits that are not related to fertility. Section 41 authorizes the Commissioner of Insurance to suspend or revoke the certificate of a health maintenance organization that fails to provide the coverage required by Section 37. The Commissioner is also authorized to take such action against other health insurers who fail to provide the coverage required by Sections 23 and 44. With that, Mr. Chair, I would now like to turn it over to Amanda Klein, the founder of Nevada Fertility Advocates, to share her story about the impact that IVF has had on her life.
Thank you, Chair Dunyate, and to the members of the committee for allowing me to share my story today. For the record, my name is Amanda Klein, and I am the founder of Nevada Fertility Advocates. 3 miscarriages, 2 medically necessary abortions, multiple tests, hundreds of needles, 2 rounds of IVF, 5 doctors, 1 surrogate, and 6 figures. This is what it took to bring our beautiful daughter into the world today. Would I do it again? Absolutely, in a heartbeat, without a second thought. But this process and this journey could and should have been so much easier for people like me and my husband. 1 in 6 Nevadans struggle with the disease of infertility. The American Medical Association has recognized infertility as a disease for decades, just like cancer, diabetes, or heart disease. 85% of Americans are supportive of IVF, and yet there is a stigma that remains. The result, we don't talk about our infertility journeys. It's too painful, it's too personal, and it's too raw. But we need to speak up. We need employers to understand how hard it is to go back to work the day after having a miscarriage. We need our families and friends to be aware of what we are going through and to be sensitive to our plight. And most importantly, we need our lawmakers to understand how big of an issue this truly is, how wide-reaching, and to act on our behalf. I support with all my heart SB 217. Fertility treatment needs to be affordable. It needs to be accessible. Infertility needs to be treated like any other disease and recognized by insurance companies as a covered benefit. Employers need to offer infertility benefits to appropriately care for their workforce. This is good for our economy and our overall health of our communities. IVF must be protected and not politicized or vilified. Doctors should be able to care for their patients without fear of retribution. Parents should be able to grow their family in the way that they see fit without going into significant debt. My husband and I have 2 successful careers, but even with 2 good salaries, we could not afford IVF and surrogacy on our own. We're in our mid-30s at this point, and my father had to sell his house and give us all the proceeds from that sale. My in-laws had to dip into their life savings. Every dollar we made went to paying them back. We are very fortunate to have a support system with these kinds of resources, but most people cannot build their families this way. Contrary to popular belief, infertility is not just a woman's issue. It affects men just as much. There is female factor infertility, male factor infertility, and oftentimes situations where both male and female factors are at play. We spend our entire adult lives trying to not get pregnant, that when we are finally ready to start a family and find out that you cannot, it is unfathomable and hard to grasp. If you cannot conceive naturally or are having a hard time getting pregnant, it is not your fault. There is nothing wrong with you. You are not damaged. You are not broken. Trust me, this is the narrative in every person's head when you go through this journey. Limiting access to IVF and other treatment modalities strips couples and single people who want to become a parent of having a child that is genetically theirs. I have heard it all throughout the years. Why don't you just adopt? Why don't you foster? Do you really need to be a parent to have a happy life? These questions, while very well intended, are like a dagger to the heart for someone going through infertility. None of these family building paths are easy. Society is essentially saying that unless you are wealthy, you do not deserve a child that is genetically yours, and that is wrong. In 2020, I founded Nevada Fertility Advocates. We are a volunteer-based organization that supports the 1 in 6 Nevadans who struggle with the disease of infertility. We do this through community awareness, employer education, and advocacy. I am honored to work with Majority Leader Canizaro as she fights for women and families, and ask that all members of the legislature join us in this fight. This bill is about fighting for families and access to high-quality care, affordable health care. Family building should not be a partisan issue. Currently, 22 other states have some form of infertility coverage. Nevada should be next. I honestly don't know what I would do without my daughter. She's really freaking cute. She's the light of my life, and she's the reason that I fight. All I want for her is a better tomorrow. Thank you.
Mr. Chair, I know that you can see that Senate Bill 217 is really an attempt to give hope to people who really do need it. For so many people, and I can personally say that for so many women and that I have encountered in my life, facing the prospect of infertility for a variety of reasons, whether that is because of a cancer diagnosis, whether that is because of deciding to have children later in life, or whether that is because there are just a plethora of other things that we are told so often, this will work. Of course it works. Everybody can just have a baby if you want to have a baby, right? And it's so much more complex than that. and for so many families and for people who find themselves in this situation. And I would be remiss, this also applies, to same-sex couples who are trying to have children who are genetically theirs, who are trying to carry a child, right? These options have to exist for them to have that hope for their family. And to say that only some people should be permitted to access medical treatment, because this is healthcare. Infertility access, assisted reproductive technology is healthcare. IVF is healthcare. To say that some people deserve to have access and some people do not deserve to have access. And so if something is not working the way that we have all been sort of conditioned to think that it just will work and shall work in this very binary way, is to deny healthcare access to so many people. And I think that this bill is seeking to provide that access to healthcare. To tell people exactly what I think Amanda articulated so eloquently. There is nothing wrong with having to face infertility. That stigma shouldn't exist. And we, as lawmakers, should be providing avenues to allow for people to access that health care. And that's what Senate Bill 217 does. We know that we have to provide protections for our providers so that they can continue to provide this type of health care. We have to provide protections for patients and clarity for them to know that they can access this and to not be afraid of that. And so that we can have some of these conversations openly, so that we can address some of those issues. I know that there are probably plenty of questions from this committee, which we would be happy to take, and certainly look forward to those. I know there are going to be some questions legitimately about costs and coverage and what that means, and we want to answer all of those questions. We have been having some meetings with folks who have raised some of those concerns. I will note, and this committee is certainly familiar with, the more that we can do in the prevention space, the more that we can do to address these sorts of situations and to give people options, I think really does help to bring down certain healthcare costs. And so I'm looking forward to the discussion today, and Mr. Chair, would love to take any questions that you or committee members may have.
Thank you so much, Majority Leader, and thank you so much for the presentation. I just want, before we let questions and answers, I just want to make sure that we repeat the ground rules for the committee hearing today. I would ask for folks not to refrain from clapping or making noises. It's just so that we can make it fair for all sides of the issue. And so I just ask for that as we go and proceed and go through testimony. Committee members, do we have any questions? Let's start with Senator Stone.
Well, first, first of all, thank you very much for the presentation, and Ms. Klein, thank you for detailing your journey, and I'm so pleased about your beautiful daughter, and the pathway to getting there was long, and it was hard. And let me just say for the record that I support IVF, that I know has assisted millions of people conceive that have had fertility or health issues like cancer. I have a medical background, and biologically, a fertilized human egg is the first stage of human development. And so I've gotten a lot of emails and have concerns, first of all, with Section 10, where it reads, a fertilized egg or human embryo that exists before implantation in a human uterus is not a legal person for legal purposes. So I guess my first question is, why is this definition used in this bill that characterizes a fertilized egg as just a piece of property rather than a stage in human life?
Thank you for the question, Senator Stone. Through you, Mr. Chair, to Senator Stone, Nicole Cannizzaro, Senate District 6. I am very glad that you asked that question. I think that I first want to take a step back and talk about, when we talk about reproductive health care, that runs a full panoply of so many things. And I think that what we have seen happen in the last few years is an attack on access to reproductive health care. And when we think about things like infertility, certainly, there are many reasons for that. But for so many families that are on that journey, how it is that they became aware of and came to a diagnosis of infertility often involved many different aspects of reproductive health care. Things like miscarriages, things like needing to have a DNC or a medically assisted abortion because there was a danger to the mother's life, because there was a danger that she would not survive. Because there were other issues that impeded that fertility journey to having a child. We live in a world where we are being told that we must think of things like that journey in reproductive health care, that journey to access that health care is somehow wrong and somehow should be sort of taken over by politicians to make those decisions. Let me first say that I have long been an advocate here of many things, from prenatal care to postnatal care to coverage for babies, to coverage in the NICU for moms who have just given birth to have access to breastfeeding, to make sure that we also have access, though, to abortion and to birth control and to many of these things. But in a world post-Dobbs, where we are told that that is not something that we are permitted to access, what we saw was the absolute ramifications that came from that decision. The overruling of Roe versus Wade meant that many people and many women were not able to access health care. People who are on a journey leading to infertility or battling with that were being told that they were not permitted to access health care. And in the wake of that, extremists have decided that part of that journey and part of that battle with politicians was to come up with this very fringe legal idea that somehow if we can just make sure that we are defining things like an embryo when it comes to IVF and like is in this bill, as a human being, that somehow we are going to save people from ever having to talk about the word abortion, or that we're going to save people from having to have those discussions. And what we saw in Alabama is that the ramifications of that idea and the ramifications of that very fringe legal theory that is sought to undermine something related to Roe v. Wade had the practical effect of completely shutting off any access to IVF for people who lived in Alabama. That was what caused what we had all sort of, I think, thought of as a safe place when we talk about reproductive health care. IVF, that sounds nice. We're all going to have children. We love babies. Let's try to support that. That's something that we all support. But when we start trying to delve into and let extremist politicians make decisions about reproductive health care, what we saw the ramifications of that be was that we shut down access to families who had embryos that were in storage, who were in the midst of actually taking medication. And Senator, I know that you're very aware as a pharmacist that those fertility drugs that you are taking, either for egg retrieval or for potential implantation, you have to take very diligently, right? Every hour on the hour for a number of days with consistent monitoring in order to ensure that you get to a place where you can hopefully become pregnant with that embryo and carry a baby to term. But because we want to get involved in these definitions of what is and what isn't, the practical effect was we shut all of that off for those families. People in the middle of those medication regimens suddenly found themselves without being able to reach the end. People with embryos were panicking about whether or not they were going to be able to keep those embryos, to use those embryos. And so the purpose of Section 10, to be very clear, is to ensure that here in Nevada, that doesn't happen. To ensure to families who are facing infertility and have already gone through so much, a cancer diagnosis, being told that because that couple doesn't look like another couple that we would typically think of, they're just not permitted to have those kinds of children. For people who've had multiple miscarriages and who have struggled with infertility for whatever reason, we don't want to cut them off from this. And so I believe that definitions like this are necessary to make sure that we are having consistent and coherent laws that protect the access to this reproductive health care and that acknowledge that we have to be able to allow for access to IVF without extremist politicians coming in and crafting some sort of backdoor definition that functionally cuts off access to that. And that's what subsection 10 is seeking to do.
Thank you. I really appreciate the answer. The other issue that you talked about briefly was cost. And Ms. Klein, you mentioned that you went into Hawk, and with the blessing and help of your family, you were able to conceive your beautiful daughter. And you said you've had some discussions with folks about costs. We're talking about $50,000, $100,000s of dollars. The cost of premiums, healthcare premiums, could dramatically be impacted by this. I was curious what your response would be to that.
Thank you for the question, Senator Stone. Through you, Mr. Chair, to Senator Stone, Nicole Cannizzaro, Senate District 6. So yes, currently where there is no coverage for an individual, they don't have coverage under their health plan, and they're seeking to access fertility treatments, whether that's ART or IVF or any of the different pieces that come along with that. A lot of them are paying cash out of pocket, including for some of the prescriptions as well. Those can be very costly when you're paying out of pocket. That is also true, I think, as Baird is noting, that is also true of almost any medical procedure. Simply going to the hospital to have a baby is exceedingly expensive. If you had to pay for that out of pocket, would be a significant burden on families. But if you have healthcare coverage, sometimes you pay, a deductible that might be high, but which is something that people can do. We certainly provide that coverage through things like Medicaid in the state. And so I think that bears noting when we talk about these sorts of treatments can be expensive. But I also don't say that flippantly in acknowledging that anytime we're talking about increasing coverage and mandating coverage for certain medical pieces or for certain health care, that could have an effect, and likely usually does have some effect on what people are currently paying for different premiums. We've been having some discussions with some of the insurers to ask them for their feedback on what might make sense in terms of the cost piece. I do think that we have some individuals who are going to give testimony and support that will likely touch on some of this. I believe that it is safe to say, and I will certainly share this information with the full committee as it kind of comes to light, but in some of our economic and fiscal analysis, for individual health plans per member per month, less than $1. I think that there's some indications, and I think you might hear from some folks that they think it to be higher, but we're going to keep having those discussions because we do believe that it should be under $1 per month per member for coverage. And we do have other states, that we can look at in other markets to sort of show how this will be utilized, what the utilization rate is, and what that might mean from a premium perspective.
Wonderful. Thank you, Mr. Chairman.
Thank you so much. Any other questions? Senator Titus.
Thank you, Mr. Chair, and thank you both for being here. And I appreciate it, certainly supportive. I have had many patients in my career as a physician have issues with fertility. Some were more fertile than they wanted to be, and others were not fertile at all. And so there's a gamut. Having said that, though, I have a couple questions specifically to the bill. On Section 9, number 2, it's really a kind of a liability piece, and it protects, in my mind, it protects those that might be harvesting the embryos and pure negligence, and perhaps, as in, was it Mississippi or whatever state it was, Alabama, that where the refrigerator became unplugged and they lost a lot of embryos, hence some decisions. And I just worry about that piece in there. Currently, for everybody who you already know, there's no law against IVF in this state. I would fight vehemently if there was ever any thought of that in this state. I believe in an individual's right to self-determination for health care. But I'm really concerned about that chapter where I could see things happening, and then the families that have committed to this lose that piece without any way to come back to that provider who was perhaps negligent or could have done better on those embryos.
Thank you for the question, Senator Titus, through you, Mr. Chair, to Senator Titus, Nicole Cannizzaro, Senate District 6. So when you look at Section 9, what that language is seeking to protect is to ensure certainly that there are protections for providers, right, and for the storage of these embryos. I think one of the questions that came in the wake of that Alabama decision was that there might be some liability if, for example, there was a doctor who was seeking to implant, right, an embryo, and maybe it didn't take. Or maybe they were looking to move that embryo, right, but they were acting within the scope of their practice. They were utilizing all of the different things and standards that they would need to abide by, were not negligent, did not commit medical malpractice, weren't violating their license restrictions, weren't doing any of the things that we would commonly sort of associate with that. And either through their practice, found themselves where there was an embryo that for whatever reason, maybe it was damaged, maybe it was lost, maybe the embryo itself, sort of didn't manage to make it for whatever reason. But it wasn't because of these things that we would typically think of as reasons to come after a practitioner, to come after a practice. We're trying to make sure that practitioners and folks who are transporting and storing these, if other states are seeking to have some of those criminal liabilities, right, or those civil liabilities, where they're acting within the scope of their practice, where they are abiding by the parameters of their license, where they're not engaging in medical malpractice, where they're not engaging in negligence, that they know that they are protected so that they can continue their practice without fear of every little thing going wrong, resulting in them facing some sort of liability. And so when you read Section 9, I think you also have to read it in connection with subsection 3, right, A, B, and C, that talks about where this does not preclude civil liability for those sorts of actions, including negligent actions, criminal liability for any act or omission that would otherwise constitute a crime, discipline or other administrative remedies. So we're leaving those in place. One of the things that I would note, this language exists here and also for our providers, is that we have passed legislation to this effect as well, that Governor Lombardo has signed. We passed Senate Bill, I believe it was 131, that had provisions to protect reproductive health care providers if they were acting within the scope of their practice, if they were not engaging in medical malpractice, if they were not committing a crime, if they were not negligent. It doesn't negate any of those other means, but it basically is there to provide protections and assurances for providers that if they are doing their job and something just goes wrong that doesn't otherwise fall into one of these other subsections of what we would typically think of as discipline or liability purposes, that they don't need to sort of fear retribution from another state or that Nevada is going to come after them for some of those malfeasances.
Follow-up, Mr. So thank you for that. I mean, I certainly understand all of that. I sat on the State Board of Medical Examiners and I was on the investigation board, and I would frequently say just because there was a bad outcome doesn't mean it was a bad doctor or there was malpractice. But I worry that just in that wording, frankly, and it talks about the outside, anything services, if they were doing outside their scope of practice, of course they could be, liable. But I worry sometimes there are bad things that happen within their scope of practice, and I worry that perhaps we're protecting them. But okay, next question, if I might continue on next section. Let's see, section 30, 31, and it's repeated here multiple times where it talks about the insurance company. They can't require an insured to pay a higher deductible copayment, coinsurance, or other form of cost sharing for the benefits required by subsection 1, other than for similar benefits that are not related to fertility. And I heard you say that it might just cost $1 to have, but you mentioned you wanted it to be affordable. So the process is there's a cost to this service. I don't know that it's ever going to be affordable per se. Somebody will pay for this. There's a cost to doing business. And I wondered if, and you mentioned it briefly, Majority Leader, about the other states and maybe getting to us, because for me this is all about, and this is not a money committee, I get it, but ultimately it does cost money, and you brought it up, so Chair, I thought I'd just address that. These other states that have passed this, the states that you mentioned, we have a template now to perhaps look and do, as you said, some actuaries and some true what does this cost, and what will be, because as I mentioned to some folks that were in my office earlier today, somebody pays for this. And as we come to all the insurers, will we all have our, because insurance companies aren't going to lose money. Somebody's going to pay for it. So are they going to pass this cost off to everybody else, right? And so what does that look like? And you mentioned $1 across thousands of people will pay $1, maybe $1 more. And I'd really like to see some numbers, because we have some real templates. We have some states that actually have done this, and I think it would be great to see for this body, this committee, and folks that are asking these questions, like, wow, what does it look like in other states? So I would really appreciate that information.
Thank you for the question, Senator Titus. Through you, Mr. Chair, to Senator Titus. Nicole Canizaro, Senate District 6. So we're talking about here, I want to address, because I think there's sort of a two-part answer. In sections 31, and it appears in other sections, it's sections 12 through 14, 19, 23, 31, 37, 38, and 44. The pieces that are talking about an insurer imposing conditions like cost sharing, prior authorizations, waiting periods, the point of that was that we don't want health plans to be treating infertility treatments differently than other similarly covered healthcare options. And so that's what that language is seeking to align, if that makes sense. And so we're not saying that some of these things might not exist for certain fertility treatments, but where other health plans are not charging this for some other things, we want to make sure that what we're not seeing is, and what this language is designed to get at. And again, I did mention that we had met with some of the healthcare plans. They're going to be getting us some things that they think might make this hopefully a little easier, maybe still not easy, so I don't want to overstate that. And I think they still may have concerns, but certainly want to make sure that as much as we can accomplish the goal of what Senate Bill 217 is seeking to do and making this something that is workable for them, we want to get there. But this language, the intent of that was to make sure that what we don't see is that because this is talking about infertility treatments, that we're going to treat that differently than we're treating other types of medical coverage. And so that's the intent of that language. And then with respect to the costs, like, yes, there are other states, right, that are providing some type of coverage. It differs, of course, state to state, as we're sort of trying to tackle this issue from a statewide level. And every state sort of has to take this sort of thing on. One of the things that I think I was trying to articulate, and I think we have some folks who will definitely come up and speak a little bit more about this, and like I mentioned, happy to share that data with you as we continue to receive it and analyze it. But I do think that when we're talking about this coverage that exists in this bill, that cost should be at around somewhere a little less than $1 per member per month. And we're still I think gathering up all of that information so that we can share that with you and certainly with everyone else who's interested in the bill.
Thank you so much. Any other questions? I have two quick ones. Senator Canizaro, I know through section 2 through section 9 of the bill talks about more so about the implementation of the bill versus the other sections that deal with health insurance. I know that obviously many of us at the state level believe in the right to IVF, but perhaps there might be local officials that disagree with us. And so if this bill were to pass, or when this bill passes, this is ensuring that everyone has that same right, regardless of where they live in this state. Is that correct? Is that a fair assessment?
Thank you for the question, Mr. Chair. Nicole Canizaro, Senate District 6. Yes, you are correct. The purposeful language in those portions of the bill are just to ensure that these sort of rights and right to access this treatment is consistent regardless of where you may live in this state.
Thank you. And just maybe a question for Amanda. Do you want to, I have heard from the grapevine that there's a lot of stories of women who have been denied the right to receive access to IVF because they qualify for Medicaid and this is not available to them. Can you elaborate on some stories that you've heard maybe from your side of why this is important?
Thank you, Chair Dunyate, for the question. For the record, my name is Amanda Klein, founder of Nevada Fertility Advocates. I can tell you a heartbreaking story. Actually, I was going through IVF and I was sitting in the clinic waiting room, and a man actually came into the clinic. He opened the door and went straight to the check-in desk. And he looked very upset, and he said to the woman behind the desk, my wife, I would like to make an appointment for her. I would like to talk about, her diagnosis. If she does have infertility, she's clearly having issues conceiving naturally. And the woman behind the desk said, "Do you have an insurance card?" And he pulled out his Medicaid card. And the woman behind the desk said, "I'm so sorry, but there's nothing I can do for you." And the man he pleaded with her for a few moments and then he left. And that just has left such an impression on me, and one of the reasons why I continue to do what I do. Thank you.
Thank you so much. Any other questions? Let's go ahead and move on to testimony. So at this time, we are going to begin our testimony for the bill. So we're going to start with support, followed by opposition, and then those coming in neutral. Because we do have a lot of folks here, we are going to have to cap testimony to 30. So 30 minutes in support, 30 minutes in opposition, 30 minutes in neutral. We do ask folks to please remind, it's okay to say ditto, not to repeat things that have been mentioned already. And then, of course, as I must reiterate the importance of not clapping, jeering, and so forth, making any statements, because I don't want to have to pause the meeting as we go through this process. And so I just ask that we keep our remarks specifically to the policy. So let's go ahead and begin here in Las Vegas, or in Carson City. Please begin.
Thank you, Chair Donate and members of the Health and Human Services Committee. My name is Jessica Woods, and I'm the current board president for Nevada Fertility Advocates. I'd like to thank you for allowing me to share my support for SB 217, a critical piece of legislation that will help expand access for fertility preservation and family-building health care for Nevadans. Fertility services are essential medical care, yet 1 in 6 in Nevada faces significant financial and access barriers. The impact of infertility on individuals can look widely different. Infertility doesn't always mean in vitro fertilization or IVF. Many individuals simply require diagnostic services, monitoring, and medications to address underlying health conditions affecting their ability to conceive. Conditions such as polycystic ovarian syndrome or PCOS, endometriosis, hormonal imbalances, and other medical factors can all impact fertility. And proper evaluation and treatment can make all the difference in a person's ability to build a family. This was the case for myself and my husband. After trying to conceive for over a year, to have that pregnancy result in a miscarriage was definitely heartbreaking and something we were not expecting. We began seeking care with a reproductive endocrinologist, and with proper diagnosis and the assistance of medication and monitoring, we were able to have a successful pregnancy. Our daughter will be 5 in a few months, and I can't imagine a world without her. While we're fortunate to have the resources to access these services, that is not the case for so many Nevadans. Additionally, fertility preservation is a vital medical necessity for individuals undergoing treatment such as chemotherapy, radiation, and other medical procedures that may compromise fertility. Without coverage, patients facing life-altering diagnosis are forced to choose between life-saving treatments and their future ability to have biological children, a decision no one should have to make. I've often heard people suggest adoption as an alternative. However, adoption is a family-building option that is not always a straightforward path either. Adoption can be a very expensive process, emotionally challenging, and does not always result in a successful outcome. By passing SB 217, Nevada can take an important step in ensuring that individuals have equitable access to fertility care they need, including diagnostics, preventive.
If you can please complete your remarks.
Yes. I respectfully ask you to support this bill, and I thank you for your time and consideration.
Good afternoon, committee. My name is Leah Kay, Leahkaye. I'm a double board certified physician in reproductive endocrinology and infertility, as well as OBGYN. I practice at the Fertility Center of Las Vegas, and I come here today to speak to all of you in support of Senate Bill 217. I don't come to you today to represent the thousands of Nevadan families that have already had their lives changed by being able to access infertility care like IVF. You've heard and will hear a number of stories from families, some of them my patients, and they can speak for themselves. They've already had the good fortune of being able to access fertility care that is safe, highly effective, and readily available to them but it shouldn't require good fortune. I'm here instead today to represent the thousands of Nevadan families who remain undertreated for infertility. This includes some 70,000 plus women in reproductive age range here in the state of Nevada, 12% of men who are diagnosed with infertility, young men and women with cancer that will affect their future fertility, families who require third-party reproduction, such as donor eggs, donor sperm, gestational carriers, and our servicemen and women who have chosen to give the best years of their life to our families, often at the expense of being able to build their own families. Last year, my practice alone saw just under 1,000 new patients, and probably at least half of them speak to me, get a little bit of information, and never show up for any diagnostic testing or to pursue any kind of treatments. Most of the time, I think it's because they know that if there's some treatment that they're going to require, they will be cash pay, and just that information paralyzes them before they've even seen a price tag or gotten a diagnosis or have any idea of what kind of treatments might be available to help them. At least another 100 over the course of last year scheduled an appointment with me and canceled for financial reasons. It is heartbreaking to see them suffer in silence, especially when I know that we have something really great that can help them. It's frustrating when they come back to me after having failed IVF in other countries, particularly because they could have accessed some of the best high-quality care from providers and clinics right here in our home state. With Dobbs and Alabama rulings, Nevada was quick and proud to remain a safe haven for reproductive freedom and the right for a person to choose when and how to build their family. And this bill will show that we meant it. Thank you.
Thank you. Let's do one more in Carson City, and then we'll go to Las Vegas.
Good afternoon, Chair and Committee. My name is Catherine Jung, spelled Katherinejung. I'm a junior at EDW Clark High School in Las Vegas, and I'm testifying in support of the Senate Bill 217. I wouldn't be here to advocate for this bill, to play my instrument in concert band, to give back and uplift my community and clubs, or to support my younger sister through life if it weren't for IVF. My parents tried to conceive a child for 4 years, but after being unsuccessful, they turned to IVF. There aren't many doctors who can perform the treatments, and the results are not always positive. The first IVF treatment my parents underwent cost $20,000, which my grandmother generously paid for. The attempt, however, unfortunately failed. The second IVF treatment required my parents to pay $30,000 out of pocket, and it resulted in my birth. While fortunately my family wasn't worried about the struggles with the expenses of my childhood, the total cost of $50,000 did take a financial toll. The inability to conceive a child is the reality for many couples who want to start a family, and like my parents, the IVF is often the only option. However, the cost of IVF and the low availability of IVF is a burden that many couples face, and which may intimidate them to forego these possibilities. The Senate Bill 217 provide ways for IVF to lower these costs, such as having insurers help cover expenses for the better of the people of Nevada. I encourage support of this bill for the people who wish for a family and the children they'll watch grow. Thank you.
Thank you so much. Let's do 3 in Las Vegas, please.
Good afternoon, Chair Jonyate and members of the committee. My name is Jennifer Atlas. I'm with the American Cancer Society Cancer Action Network. ACS CAN is the nonpartisan nonprofit advocacy affiliate of the American Cancer Society. We advocate for evidence-based public policies to reduce the cancer burden for everyone. ACS CAN supports legislation that provides cancer patients with health insurance coverage for fertility preservation consistent with recommended medical guidelines.
Hello, my name is Amanda Voskov, VASKOV for the record. I'm a board member of the Nevada Women's Lobby. The Women's Lobby and I have long supported legislation that preserves reproductive freedom, like the bill before us here today. But more important than all of that, I'm here today because of IVF. I'm an IVF baby. My loving and supporting parents, who truly deserve to be parents, were able to start a family thanks to IVF, a treatment responsible not only for my birth, but for 4 million births annually in the US. This bill expands IVF coverage, provides patient protections, and most importantly, ensures embryos do not hold personhood status under the eyes of the law. If embryos were granted personhood, fertility providers could face legal consequences for standard treatment, restricting access to care and threatening the very treatment that made my existence possible. Reproductive freedom is about choice, opportunity, and as Majority Leader Canizaro mentioned, hope. The hope to have a family, the hope to have children, and the hope for people like me to be here today. That's what SB 217 protects. That's why I urge your support. Thank you.
Good afternoon, Chair Doñate and members of the committee. For the record, my name is Sue Birch, S-U-E-B-U-R-T-C-H. I am the Executive Director of the Nevada chapter of the National Organization for Women, and we strongly support SB 217. Two of our core issues are reproductive rights and justice and economic justice, and this bill covers both of them. And we would like to thank Majority Leader Canizaro and her guest presenter, Amanda Klein, for bringing this bill forward, and we hope the committee will support SB 217. Thank you.
Thank you so much. Let's go virtually, please. AVH, is there anyone online that would like to testify? We'll take 3.
If you'd like to testify in support on SB 217, please press star 9 on your phone to take your place in the queue.
Hi there. Good afternoon, Chair and committee members. My name is Bree Schmidt, B-R-I-S-C-H-M-I-D-T, and I'm a program associate with Silver State Equality, Nevada's statewide LGBTQ+ civil rights organization. We seek to bring the voices of LGBTQ+ people and allies to institutions of power in Nevada and across the United States. All Nevadans deserve access to health care for both themselves and their families. SB 217's protections for assisted reproduction help protect all Nevadans. We support SB 217 and urge you to support this as well. Thank you.
Thank you, Chair, members of the committee. My name is Shelby Swartz, and I'm here today as Executive Director of Battleborn Progress in strong, unwavering support of Senate Bill 217, because access to IVF and fertility care is not a privilege, it is a necessity. Every day, I see firsthand the heartbreak of infertility. I'm part of online communities where thousands of women and families share their struggles, where they post negative pregnancy tests month after month, where they grieve devastating miscarriages, where they endure the physical and emotional toll of fertility treatments with one singular hope: to become parents. Denying coverage for IVF is denying people the ability to build their families. And now, with federal threats looming, with political attacks on IVF and reproductive medicine gaining ground, the need for Nevada to act could not be more urgent. I commend Senator Canizaro for leading the charge with SB 217 and for standing up for families across Nevada. I also want to honor the brave individuals who have shared their deeply personal fertility struggles today. Your voices matter, your stories matter, and your fight for a family is worth protecting. I urge members of the committee to support this bill, and again, I thank Senate Majority Leader Canizaro.
Chair, there are no more callers in support at this time.
Thank you so much. I see one person in Vegas, so we're going to go there and then we'll come back down here.
Hi, my name is Dr. Joey Adashek, A-D-A-S-H-E-K. I'm the president of the Nevada State Medical Association. We are the organization that represents the physicians in the state of Nevada, and I'm here representing that organization. We want to come out in strong support of this bill. I'm board certified in both OBGYN and maternal fetal medicine. I'm the founder of Desert Perinatal Associates in Las Vegas, and we now have about 35,000 patient visits per year. I'm also associate professor of both University of Nevada Schools of Medicine. Lastly, I serve on the State of Nevada Maternal Mortality Review Committee. Approximately half of all the patients I deliver became pregnant via in vitro fertilization. When most people think of in vitro fertilization, they tend to think of the older woman in her 40s that prolonged childbearing due to their career. While that is one of the indications, I'd like to talk about some of the lesser known indications. Picture, if you would, that you or your spouse became pregnant. All of the ultrasounds that look for birth defects were totally normal. You go on to have a beautiful, healthy baby. There's no family history of any childhood diseases or any complications. Then, after a period of a few months, you notice that your baby starts to have decreased muscle tone. Mild at first, but as time goes on, it becomes much more noticeable. The baby soon cannot sit up, cannot turn his body over, starts to choke as he swallows. The child starts to have seizures, which is incredibly scary. You have to admit your baby or young child to the hospital and watch as your baby slowly goes downhill. Soon, the baby becomes blind and deaf. the quality of that life still goes downhill from there. You have to watch your child start to suffer as swallowing becomes impossible, and then breathing becomes impossible. The child now has to be intubated as he continues to suffer more and more until he finally succumbs to his disease and dies a very painful death. I've just described the death of many different autosomal recessive diseases, such as Tay-Sachs disease and spinal muscular atrophy, which is the most common cause of neurologic death as a baby. Most of these lethal genetic diseases, such as spinal muscular atrophy, are but just a couple of them. There's a 1 in 4 chance that their next child will suffer the same horrible fate. Once pregnant, she could have an amniocentesis,
Sir,
which involves
if you
sticking a
can
needle
please
into the
complete your
pregnant
remarks.
uterus. Oh, sure, around 16 weeks. They can then choose whether or not to continue. Now with IVF, in vitro fertilization, they no longer have to suffer that same fate ever again. Thank you very much.
Thank you. Let's come back here in Carson City. Please begin.
Good afternoon, Chair and committee members. My name is Sabrina Schnur, SABRINA-SCHNUR. I'm here today on behalf of the Leukemia and Lymphoma Society and the Nevada Public Health Association, just offering our support. Thank you.
Good afternoon, committee chairs and members. My name is Crystal Villarin, CRYSTALVILLARIN, and I'm a volunteer with Nevadans for Reproductive Freedom, and I strongly support Senate Bill 217 as a young lesbian who hopes to have a family one day. For same-sex couples like me and my future partner, starting a family isn't as simple as it is for others. Fertility treatments like IVF aren't a luxury, they're a necessity. Yet financial barriers make access difficult and make it harder for LGBTQ plus folks to access that same fertility care and for that same opportunities to build a family. The ability to have children shouldn't depend on who you love or your income status. Senate Bill 217 will help people like me and people like me who depend on IVF to start a family and have that same access to the fertility care. And I urge you all to vote yes. Well, thank you.
Thank you, Mr. Chair, and the committee for letting us speak today. My name is Kendall Servino. For the record, that's Kendahl, last name SCRV as in Victor, INO. My name is Kendall Servino. I am a board member of the Nevada Fertility Advocates. I am a UNR School of Medicine graduate and a current pediatric resident physician. Prior to starting chemotherapy, I was asked whether I wanted to be a mother one day. Having just received a life-altering diagnosis of cancer 1 week prior, my potential for motherhood had not been on my mind, not with the more impending matters of my hair loss, whether I would need to take time off from college, postpone my medical school application, and of course, whether I would even have the opportunity to live. I was 20 years old. So much of one's life course is altered immediately after the 3 short words, "You have cancer." For me, this included my decision to spend my career advocating for children as a pediatric physician as I stand before you all today. Chemotherapy alone has a plethora of side effects, but one unexpected and often overlooked is iatrogenic infertility, which is infertility caused by medically necessary treatments such as chemotherapy, radiation therapy, or anything else that may render one infertile. Many cancer patients will turn to assisted reproductive technologies, or ART, to help preserve their fertility before starting chemotherapy, which can have very damaging effects on the body due to the toxicity of the treatments. In most states, this is considered elective. It is not covered by insurance, and for many cancer patients, this places a colossal burden on top of an already devastating time to focus on having a family in the future. For many cancer patients, including myself, sometimes all we want is to retain as much of a sense of normalcy as we all can and to have a healthy, promising future. And for those of us who want it, that future should include the possibility to have future families as well. Cancer already takes so much of us. It doesn't need to take this away from us, too. I am honored and excited to work with Senate Majority Leader Nicole Cannizzaro as we persevere in this journey once more, and we fight again in this upcoming legislative session. I support SB 217 wholeheartedly, and I encourage members of the Nevada Legislature to support it as well. Thank you.
Good afternoon, Chair Dunyate and members of the committee. My name is Carrie Harrington. I'm the Executive Director for Nevada Cancer Coalition. I'm here to support SB 217 on behalf of those affected by cancer, but you heard a beautiful testimony in that regard. Approximately 160,000 people per year in the United States are diagnosed with cancer during their reproductive years. And you've heard the damage that it can do. So I'll just jump to this. The American Society of Clinical Oncology recommends, and I quote, providers should be prepared to discuss fertility preservation options and/or to refer all potential patients to appropriate reproduction specialists. Although patients may be focused initially on their cancer diagnosis, providers should advise patients regarding potential threats to fertility as early as possible in the treatment process so as to allow for the widest array of options for fertility preservation. The discussion should be documented. Sperm, oocyte, and embryo cryopreservation are considered standard practice, end quote. Our coalition supports SB 217 to increase access to critical fertility preservation in our state. And on behalf of those with cancer, we also support a more inclusive definition of treatment-related infertility to address the full range of potential treatments and targeted cancer therapies that can adversely affect fertility. Multiple fertility preservation cycles, the collection and storage of all gametes to include sperm, and potential support services needed for those with cancer. Thank you for your work on this bill, and thank you for supporting it.
1 second before you begin. If there are any folks, we only have 10 minutes left in support testimony, so if there's any folks in the overflow room that want to have the chance to testify, now would be the time to come over. Please proceed.
Good afternoon to the chair and the committee. My name is Aaron Sebastian, Aaron Sebastian. I'm a high school student from Las Vegas. I also serve as the state chairman of the Nevada High School Democrats, and I'm the founder of Teens Against Trafficking. I'm testifying in support of Senate Bill 217, not only for the Nevada families of today, but for those in years to come. Through my work, I've seen firsthand how reproductive autonomy is deeply linked to the ability of survivors to rebuild their lives and reclaim their futures. For survivors of human trafficking and domestic violence, reproductive control is one of the first rights that are stripped away from them. Traffickers force contraception or unwanted pregnancies on their victims, using reproductive coercion as a means of control. Abusers frequently manipulate fertility, which denies survivors the ability to make decisions about their own bodies. Survivors are often forced into pregnancies they are not prepared for, or forced abortions or sterilizations. Teen survivors, my peers, have been coerced into sexual abuse and who have survived unimaginable trauma must have reproductive justice upheld for them. And for survivors who escape these abusive relationships, who have little to no financial resources, this piece of legislation makes family building possible. Expanding insurance coverage for infertility treatment under this legislation opens up opportunities. Your vote in favor of this legislation is essential. I also testify here on behalf of my generation, a group of Nevadans who in the future hope to start families of their own. Upholding access to infertility treatment should be protected for future generations to come. At the end of my time here, I urge you to support SB 217. In Nevada, 40% of women experience domestic violence in their lifetime, including reproductive coercion, which is a lasting impact on fertility. Survivors have had so much taken away from them. Let's not allow access to IVF and family building to be another stolen choice. Thank you.
Thank you, Chair. My name is Erica Gillette, ErikaGillette. Speaking right after Aaron really makes this point. I have worked with college-aged men and women in Nevada for almost 20 years. In that time, I have heard them become increasingly anxious and fearful about their futures. They are hesitant about the cost of education and the cost of home ownership, and they struggle to imagine being financially stable enough to start families. They need to see that they will have the options they need when they are ready, and they don't see that right now. Fertility care is not just about women, it's not just about age. It allows people to build secure families after they have survived hardships like cancer, PCOS, and other things you've heard today. I'm here to urge you to ensure that in Nevada, people continue to have these options, no matter what happens in other states. Thank you very much for your time.
Marco Rauda, MARCO, RAU, representing Americans for Contraception. Just wanted to thank the majority leader for bringing up this bill, and I wanted to thank this committee for listening, and just want to echo what everybody just said. Thank you.
Good afternoon, Chair and esteemed committee. For the record, my name is Simar Jolly, that's spelled SIMARJOLLY, and I'm here to speak in strong support of SB 217. I've had the opportunity of being involved in a lot of things. I'm a high school student who's a part of the South Asian Women Alliance of Nevada. I sit on the board for 2 nonprofits in Las Vegas, and in general, I'm just a really fun person to be around. And that's why today's testimony is deeply personal to me, because without IVF, I would not be the person I am today. Matter of fact, I wouldn't be here, period. My parents struggled with pregnancy, a reality that affects millions of families across the country. For them, IVF was not just a medical procedure, it was a lifeline. It gave them the chance to experience the joy of parenthood, and it gave me the chance to live. Not only does this bill make IVF more accessible, but it ensures that it remains protected. While it's true that there's no law preventing IVF, it's also true that there's no specific law protecting it either. IVF has allowed countless parents, those with fertility challenges, cancer survivors, and even couples facing genetic risks to bring healthy children into the world. Restricting or banning access to IVF would not only deny hopeful parents their dreams, but also undermine the fundamental right to family building. It gives hope where there was once despair. To deny access to IVF is to deny future children the opportunity to exist and deny parents the opportunity of parenthood. I urge you to support SB 217 and to stand with families who dream of having children. Thank you for your time.
Hello, committee members and chairman. My name is Bill Sims, S-I-M-S, and I am here to speak in favor of SB 217 because as a person who needs Medicare and Medicaid myself to cover the cost of my health care, including 2 brain surgeries that I had last year, I understand the importance of insurance coverage to help cover the cost of receiving IVF treatments. I believe that no one should ever have a heavy financial burden for simply wanting to have children. So I implore you to please vote yes on SB 217 to protect the rights of fertility care and help Nevadans cover the financial costs of receiving IVF treatments. Thank you for your time.
Thank you so much. We have time for 2 more, so we'll go here.
Good afternoon, members of the committee. My name is Menon Ashagri, M-E-N-E-N-A-S-H-A-G-R-I-E. I'm a second-year medical student with a strong interest in reproductive health and OBGYN. Through my medical education and thorough research on oncofertility, I have come to understand the profound impact that life-saving treatments such as chemotherapy can have on a patient's fertility. Patients undergoing these treatments often face the difficult reality of having to choose between financial burden versus being able to preserve their fertility. And a lot of these fertility preservation methods remain out of reach for many due to cost barriers. As a state, it is incredibly important to recognize the need for this coverage and support SB 217. This bill ensures that patients are not forced to choose between their health and their future ability to have children. I urge you to support SB 217 and take an important step towards equitable reproductive care in our state. Thank you.
Good afternoon. My name is Lynette Frerichs, L-I-N-N-E-T-T-E-F-R-E-R-I-C-H-S, for the record. I'm a born and raised Nevadan, nurse, and possibly my proudest achievement, a mother to a beautiful IVF miracle. Like many others, my fertility journey has not been linear. I changed jobs to a role that was more supportive of the time required to attend fertility appointments, worked extra shifts to pay for treatment, took on debt, which I am still paying on, and asked my family to travel hundreds of miles and help give me countless injections, all for the chance to have a baby. And when that day finally came, I only had 2 chances. 2 embryos with so much potential, but no guarantee of a child. Having 2 embryos like I did is more common than not. Some people go through this process and walk away with nothing. No eggs retrieved, no embryos, no baby, and no physical, emotional, or financial resources to try again. However, my story has a happy ending. My first transfer was successful and resulted in my 1.5-year-old daughter. We still have another embryo that we are hoping to give a chance in the upcoming year. I urge you to support Senate Bill 217, as this bill could make the difference between somebody starting a family, preserving their fertility, or remaining childless. No one should have to choose between the dream of parenthood and financial stability due to lack of insurance coverage or limited access to care. Thank you.
Thank you so much. I do have time for one more. If there's one person that would like to come and testify. Please begin.
Thank you. My name is Cecilia Lampley, Cecilia I'm a retired therapist, marriage and family therapist. I worked at Children's Behavioral Services as a therapist, and most of the people that we had coming there had no problems giving birth. And many of them were not attached to their babies. They were not that involved with their children's lives. And I think with IVF, the extent that people have to go to have a baby seems to me like they love their babies when they have them more than any of the babies that were born, and that were born easily to parents. And the other point is I think all children should be loved.
Thank you so much. All right, that concludes our support testimony. And so now we will go ahead and begin opposition testimony. So if anyone would like to testify in opposition to this bill, we ask for folks to please come forward. You may begin.
Chair Gignate, committee. Hi, Shelley Capurro, representing the Nevada Association of Health Plans, which is a 10-member organization of health plans with both commercial and public plans. And we want to thank the majority leader. We've already started conversations on this bill, and we have made promises to move forward. As currently crafted, we have to oppose the bill, but appreciate her time. The infertility coverage mandate applies to large employers, which means that the cost for employers and employees will increase due to the cost of these treatments. Employers should have the flexibility to choose the coverage that best meets the needs of their employees, and as currently written, that is not an option. We also have concerns with the opening of a special enrollment period for pregnancy, as that could incentivize some individuals to wait to enroll in coverage until they have already become pregnant. Additionally, with a new federal administration, there are CMS guidelines that have recently been released on special enrollment periods that could conflict with this bill. We promised the senator we will work with her on achievable goals, and we do look forward to collaborating with her on this issue. Thank you.
Thank you, Chair and members of the committee. Melissa Clement with Nevada Right to Life, MELISSA, CLEMENT, in opposition to SB 217. Due to the definition in Section 10 and the blanket immunity for a class of doctors in Section 9, both of which are very concerning. SB 217 explicitly states that fertilized eggs and embryos before implantation are not legally considered persons. This is neither scientific nor medical. It is merely, maybe, I don't know, a business classification. As the bill sponsor mentioned, the Alabama Supreme Court decision is the precursor to this bill. The Alabama Supreme Court ruled that frozen embryos created through in vitro fertilization are legally considered children under the state's Wrongful Death of a Minor Act. That court rightly acknowledged that frozen embryos deserve legal protection under wrongful death statutes. This decision, the Alabama decision, was not about abortion politics. It was about holding clinics accountable for negligent practices that harm families and their embryos. The families that lost embryos in Alabama did not see them as mere property. They were future family members and represented hope beyond belief. And when those embryos died, it wasn't a property tort thing, it was a human. And my worry is that if this is passed with that definition, that it leaves so many of these families that have these heartbreaking stories we've listened to today, it leaves them unprotected. Section 9 of SB 217 grants broad legal immunity to individuals and businesses involved in assisted reproduction, shielding them from civil, criminal, or administrative liability. This bill, as it's written, endangers the very people it purports to help by prioritizing industry profit over patient safety and ethical integrity. Thanks.
Sir, if you can use the mic, please. The mic. Press the button. Thank you.
Thank you. Thank you very much, members of the committee. My name is George Pastrozny. I'm a resident of the city of Reno, and I'm a lifelong Democrat, a retired attorney, and although not representing Democrats for Life, which is a national organization, my personal views I expressed today are consistent with their policy positions. My testimony today is limited exclusively to opposing the existence of Section 10 in this piece of proposed legislation. I believe that it's inconsistent with the evolving state of medical scientific research in embryology and neonatal and human development. In support of that, I've submitted through the record a policy paper of the American College of Pediatricians, which point out that from their point of view, the preponderance of medical evidence is that a human life and a human being is created upon the completion of fertilization by a sperm of an egg. In other words, the creation of a zygote. I would distinguish this kind of medical scientific factual finding from the notion of personhood, which is what the Alabama Supreme Court dealt with. That's a legal concept involving the status of someone for purposes of constitutional protection. That is not what the notion of a human being is. And so again, I think by trying to undefine what a human being is, by overlaying medical scientific perspectives, is a disservice to this piece of good public policy legislation. And I believe that in response to Senator Stone's question on this provision, the sponsor of this mentioned some problems. And I believe that Section 9 more than satisfies the concerns relating to those provisions. And Section 10, I would strongly suggest, be deleted from this piece of legitimate legislation. Thank you.
Good afternoon, Chair and Senators. My name is Jim DeGraffenried. I'm Nevada's Republican National Committee man, and I'm here today in opposition of SB 217 on behalf of the Nevada Republican Party. We ditto the concerns expressed by Nevada Right to Life. While we are in support of IVF and the availability of IVF to families who need it, we are concerned about some of the details in the bill, as was mentioned. One concern that was not mentioned that we have is the significant fiscal note attached to the bill. There's a $38 million fiscal note submitted by the executive branch, primarily due to the need to provide IVF to Medicaid beneficiaries. I noted in that bill that in that fiscal note that it was an estimate, and it was an estimate because they indicate that no other state currently offers IVF to their Medicaid beneficiaries. And so we're concerned at this point in this current environment about breaking new ground there and having Nevada be the first at maybe some unknown cost that we're not aware of. So for that, at this point, we need to be in opposition to the bill. Thank you.
Thank you so much. Anyone else here in Carson City or in the overflow room? Anyone in Las Vegas? AVH, is there anyone online that would test? Oh, looks like we have one person in Vegas. Couple folks. You may begin.
Hi, my name is Alex Slack, and I'm a constituent here in Las Vegas, Nevada. And while I do stand in opposition of this bill, I will say that it is very difficult to do so, because as hearing everybody who stands in support of this and who is desiring to have that family is something that's very heartwarming, as it goes against the cultural norm of being anti-child right now. And so taking this oppositional stance right now is not something that is taken lightly, I'll say that. But with that said, in good conscience, we cannot support this bill because of the political interpretation that is defined in Section 10 as far as what an embryo is. And despite what it says, an embryo is actually a preborn person, a preborn baby, a preborn child. It is a preborn human. And to say that they are less than that is actually dehumanizing. And the dehumanizing of people right now in this culture is what has led to previous atrocities in our history. And so at some point, we do have to take that stand to say a human is a human, a child is a child. Also, as brought up in the Alabama case, I know people up north in Crescent City had already covered this, but the Supreme Court of Alabama did rule in that case that the IVF embryos should be considered children and not just inanimate objects. Okay, and then on average, 10 embryos are developed per patient when receiving IVF treatment. And out of that, maybe 1 or 2 will actually be used. That means that the other 9 will either be frozen or destroyed. What this bill would essentially do is make the people of Nevada fiscally responsible for the destruction of preborn babies, preborn children, preborn humans, all via Medicaid. And so since Medicaid is paid by our taxes, I'm asking you to represent me as a constituent and as a taxpayer to oppose this bill. Thank you.
Hi, my name is Frank Bella. I also oppose this bill based on just the whole idea of when life starts and begins. And as Alex just previously said, the waste or the death of the other embryos that don't make it is just against my Christian beliefs. And, it may not be popular to be a Bible-believing Christian today, but I have to stand against this bill for that reason, that it is life, and it's like picking one life out of many lives. And also, I just believe that also like how Alabama spoke about it being a life. And, it is heartbreaking that people want to have kids and stuff and they cannot. But I don't think that I, as a taxpayer, should have that burden to pay for that. And, life is not fair at times. There's many situations, but I just stand opposed to this bill, and I thank you for your time.
Hi, my name is Carlo. I oppose SB 217, Carlo Maloof. The one thing that struck me as I'm listening to all the testimony here, that's one of the things that I did not hear a moral decision being made here. It all talked about cultural ways of thinking. There was really no morality to the decision that was needed to be made here. It just seems to be also incremental to a disposable children, very incremental. This is just a stepping stone. I can kind of see it already happening. Designer babies. One of the things that, as I'm listening to everybody, is how do you solve infertility? How do you solve that? Kids are best born between when you're 20 and 24 years old. And so people are putting off infertility for a long time. Why are they doing that? What's the priority? And then all of a sudden the sky is falling and they're 30 and 40 years old and they need to have a baby when the window of opportunity is evaporating. And so for some reason the sky is falling and we have to do something out of the norm on creating babies. It seems kind of odd to me. Throwing away human beings seems really odd. Another thing that I hear, that infertility is a disease like cancer. That doesn't make any sense. Disease is a condition that impairs normal function. Well, the normal function of having a baby is between 20 and 24. That's the normal function. That's when you're most fertile. So what are you doing? I don't understand. It's not a disease. It's a choice to hold off babies. It really is. So stop flirting with Mother Nature. Stop flirting with God. And stick to the program of having babies when you're supposed to have babies. Thank you.
Hi, thank you. My name is Grace Trejo. I'm a public health nurse and representing traveling nurse evangelists. I'm not here to criticize the decisions of people, but I am wanting to focus more on the stakes on making bills only on one side, and we're using it for emotional and trying to buy people's opinion on emotions. As engaged in stakeholders in Nevada, we oppose SB 217 due to its implication to religious liberty, the insurance sector, and economic stability. While the bill aims to enhance access to reproductive health care, it imposes burdens that could undermine foundational beliefs, destabilize insurance markets, and strain taxpayers. Let's learn from New York, California, and Texas when this was mandated. SB 217 requires insurers, including those with religious affiliations, to cover infertility treatments, which conflicts with many spiritual doctrines. And the bill's narrow exception may force faith-based entities to compromise their beliefs or exit the market. Although it offers immunity to healthcare providers involved in assisted reproduction, it does not protect those with conscientious objection, risking legal repercussions for practitioners who refuse procedures they find objectionable. The definition of a fertilized eggs, as mentioned earlier, challenges the pro-life view that begins in conception, provoking backlash from life-affirming believers. And it leads to legal disputes over religious freedoms. Mandating coverage for infertility treatment is likely to raise premiums, worsening the affordability crisis for small businesses and economically disadvantaged families. Additionally, complex regulation may harm smaller insurers, reducing competition and consumer choice. It raises serious concern about religious freedom, elevates healthcare costs, and jeopardizes the stability of Nevada's insurance market. So just let's think about that before we even focus on one side only. Let's make policies that benefit both sides. Thank you.
Good afternoon. My name is Jennifer Fenty, and I have read some of this bill. I oppose this bill. I do feel bad for the people who cannot have children, but I do not think that should be a bill that Christians are involved in, that we don't have a decision on that. And I think that you guys as lawmakers are involving yourself in some things that should not be involved. You already okay abortions, and now you want to okay this. It's just something to think about, and I thank you for your time.
Thank you so much. Anyone else? Let's go to AVH. Anyone online, please?
To testify in opposition on SB 217, please press star 9 on your phone to take your place in the queue.
My name is Emily Nimnah, Minnaughh. I am a Nevada resident attorney, and I am testifying today on behalf of the Pacific Justice Institute Center for Public Policy. I'd like to repeat and reinforce the prior testimony in opposition to this bill, and I'd like to add one lawyer-specific attorney note. Today, Senator Majority Leader Cannizzaro referenced, and others have also referenced, an Alabama Supreme Court case from 2024, and I think some specific background on that case from a legal perspective is relevant to her comments, and I think might help address Senator Stone's questions about Section 10 and the legal definition or non-definition of what is a human embryo. For background, that Alabama case is LePage v. Center for Reproductive Medicine. It was issued on March 14, 2024, and that ruling was very specific to an Alabama state law, the Wrongful Death of a Minor Act, which dates back to 1872, and addressed some heartbreaking facts that for non-lawyers is helpfully summarized for free online by Johns Hopkins Bloomberg School of Public Health. And in those heartbreaking facts, basically frozen embryos were destroyed when they were dropped on the ground. And it was those facts that court was responding to. And again, that was an Alabama state-specific law, and obviously we don't have that Alabama-specific law here. So if the goal really is to address concerns arising from that Alabama Supreme Court ruling, I would suggest that we should look to our own Nevada wrongful death statute, which is in NRS 41.085 with respect to heirs, And I would suggest that civil liability could be discreetly and respectfully addressed through a tailored amendment to that NRS provision, which is again NRS 41.085, and not through this overbroad, unscientific, and controversial language. So you could strike Section 10 and still respectfully address the concerns raised by that Alabama case. Thank you.
Hi, my name is Elisheba Delote, Elisheba, last name Delote. Thank you for allowing me to speak. I am opposing this bill SB 217 due to its potential to increase financial burdens to a higher insurance premium, 0.5% to 1.1%, and unfunded mandates on state and local governments. The bill grants broad immunity to fertility providers in reducing accountability and raising ethical concerns, particularly with the denial of embryos' legal personhood. Additionally, the increased risk associated with IVF, such as preterm birth and low birth weight, pose significant health challenges. Prioritizing egg freezing over fostering family-friendly workplaces is not in the best interest of employees or society. And I urge for all Christians to reconsider this. We should not play God. We should not squeeze the hands of our God Almighty just to force our own emotion to have babies. Just remember the story of Abraham and Sarah. There's always a ramification to the things that we make decisions just because we want something that we cannot have. I myself don't have children. I am not gifted for that. So I'm speaking in the moral grounds here. Let us think before we make decisions. And I urge to look at your conscience and your moral values and beliefs, members of the committee, and decide to make a decision to oppose to this bill. And I thank you for my time. Have a blessed night.
Good afternoon, members of committee and chairman. My name is Christiane Mersch, last name Mersch. I'm speaking on behalf of Nevada Right to Life. I'm a board member. I want to confirm all the comments from Melissa Clemens, our previous comment in opposition. Also, I wanted to reinstate that also as a religious minister, Christian minister in Nevada, I feel very uncomfortable with this bill. Sadly, I feel sad for families that cannot have their children. It's heartbreaking, but I feel that I'm going to be participating as a taxpayer, violating my conscience, because I believe embryos are human beings. I believe that life begins from conception. So we are concerned about our religion's freedom and the sanctity of human life in this bill. So there's all these ethical points, but also the financial points too. It's not clear. It's going to be a high cost. So human life has immeasurable value in all its forms, including the earliest stage, beginning with fertilization. Embryos should never be treated or destroyed. So unfortunately, some IVF practitioners create numerous embryos, and they're like to die or be frozen for an undefined period. So that's I'm opposing. Thank you for your time.
Hello, everyone. My name is Leslie Quinn. I'm a registered voter in Clark County. I ask my SD8 Senator, AD5 Assemblywoman, and all legislators to stand with me and oppose SB 217. I also support all the opposition that was heard before me. Making IVF affordable sounds reasonable, but SB 217 passes the cost to others. paying for insurance as it would mandate public and private insurance, and primarily Medicaid, to pay for the treatment for infertility. Having children is costly, whether natural, adopted, or via IVF, not only financially, but emotionally, spiritually, physically, and a huge time investment. But no matter their cost, children are a gift from the Lord. Children are the responsibility of their parents, and that responsibility should not be placed on others or the government. While infertility is an unfortunate condition for men and women, it is not a curse. It is a doorway to adoption, a lifetime opportunity to change the life of one child at a time that needs a loving home. Sadly, there are many more passionate about finding homes for dogs and cats than humans. I'm curious, when IVF is used, why the parents don't just harvest the eggs that a woman plans to implant in the womb. Of course, there's a high risk that some of the fertilized eggs will miscarry, but this would be natural expulsion instead of purposeful destruction. We are human beings, not simply an embryo or fetus for sale or destruction at will of the highest bidder or lifestyle convenience. There are many fertilized eggs destroyed via IVF. Do their lives matter? I ask all legislators, please oppose SB 217 and stop the justification of bad practitioners and the redefinition of personhood, no matter what stage of life a human is in, a fertilized egg or a fully developed human baby. Please support being pro-human and end the needless slaughter of innocent unborn human lives. Oppose SB 217. Thank you.
Good evening, everyone. CYRUS, HOJJATY. I will stand in opposition. I will ditto the previous and future presenters. And thank you for accepting my call. The other meeting I couldn't call in. Yield.
Chair, there are no more callers in opposition at this time.
Thank you so much. I'm going to go ahead and close testimony in opposition. Now, for folks that would like to testify in neutral on the bill, if you can please come forward. Please begin.
Thank you, Chair Dunyate, members of the committee. Adam Plain, PLAIN with the Nevada Division of Insurance. I did submit written testimony in the neutral position on this bill. Division of Insurance just wants to clarify the probably verbose and inarticulate section at the beginning is meant to indicate that the division, I don't think, would ever prohibit an insurer from offering any particular coverage, right? We're a government entity as defined under this bill. But we do want to clarify that for those policies which are not required to cover in vitro fertilization or other procedures, that the language that a government entity can't expressly, effectively, implicitly, or has implemented single out assisted reproduction or any drugs or device wouldn't require us to force an insurer to provide coverage when it's not otherwise required by state or federal law or under the contract, right? We don't want it as a backdoor. The last paragraph of my written testimony, I just wanted to clarify. There is maybe a little bit of a terminology disconnect in the bill. It references insureds. Typically, we talk about employees or whatnot. Insureds is a little bit of a malleable threshold that could cause some enrollment and coverage issues. And then finally, second to last paragraph, we do note that the open enrollment mandate was tried in Nevada previously in Assembly Bill 425 from the 2013 session. I actually wrote that, so I was really proud of it, but we did repeal it in the 2019 session due to various concerns with year-round open enrollment provisions. Again, we don't opine whether this is good or bad. We just want to bring it to your attention so you can do your own research as you choose to make your own decisions going forward. And then finally, because the bill would only affect policies with 100 or more insureds concerning the benefit mandate, we've evaluated this bill as not triggering federal defrayal provisions. Thank you.
Thank you so much, sir. Anyone else wishing to testify in neutral on the bill? Seeing none here or in Las Vegas, AVH, is there anyone online?
To testify in neutral on SB 217, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you so much. Our majority, do you have any closing remarks?
Thank you, Mr. Chair, and members of the committee for allowing us the time today to present to you Senate Bill 217. I wanted to address just a couple of things that came up in some of the testimony that you heard. There is a portion of the bill that does allow for a special enrollment period and that allows for pregnancy as a qualifying event. I do think that in conjunction with providing in vitro fertilization and assistive reproductive technology, obviously these are people and couples and families who are trying to have children and trying to become pregnant and want to make sure that to the extent that sort of plays into this, right, and this whole idea that we want to make sure that people have access to appropriate reproductive health care, including things like prenatal care, including things like postnatal care. We want them to be able to get that coverage, right? And so this sort of fits squarely within that to be able to ensure that as we're talking about growing families, as we're talking about having babies, that we're doing so in a way that allows people to access that health care and have healthy pregnancies along the way. And so that was sort of the reason for the inclusion of that particular piece. And obviously, I do want to extend my thanks to the health plans for reaching out, and we're going to keep working with them to see and make sure that whatever it is that we are placing before this committee with whatever amendments makes the most sense for us to be adopting as a legislative body. We, of course, know that anytime we're talking about insurance coverage, we are talking about the costs of covering that coverage, right? And making sure that people have access to that health care. And we do so through making sure that certain things are covered. That is something that we do across the board for so many different things. I think about having my own babies. And there was plenty of pieces within my health insurance coverage, right, that covered different pieces of that covered things like ensuring that I could get access to high-risk doctors as was deemed necessary, that might not pertain to all patients, but definitely would pertain to my situation. And so I think that when we're thinking about some of these things and the questions that this committee should be answering, we do have to take a minute to think about whether or not this is healthcare that deserves to have some sort of ability for families to obtain coverage so they can actually access it. And of course, it's going to come with costs, and we can certainly have those discussions. But to sort of say that because of costs, we just shouldn't have the discussion at all, I think is belied by the very things that we do in this committee every single day, and even the coverage that each and every one of us may have or has had access to. And so I just wanted to sort of note that obviously we're working through those pieces, but to give that as a reason indefinitely to not pass Senate Bill 217, I think does a disservice to the people of this state. I wanted to talk just a moment because there are a lot of mentions, and I want to be very clear about this within Section 9 on what has been referred to as blanket immunity. If you look at the plain and clear language of Section 9, this is very expressly not blanket immunity. When we talk about making sure that there are provisions that protect our providers, I, again, noted in my testimony, we have passed legislation similar to this. It has been signed, passed by this body and by several members, I think almost every member of this committee in the last legislative session, and certainly by our signed into law by our governor, that allows for the acknowledgement that engaging in certain medical practices in the world in which we live in and the laws that we live under today may present some inherent dangers without appropriate protections that open them up for liability and for discipline, just by the sheer virtue of them practicing in that particular area. And when we talk about, there's been a lot of discussion around the Alabama case. To be very clear, that Alabama case was a suit by families who had lost embryos due to someone sort of damaging them and entering into a place where they were not supposed to be in the hospital and damaging embryos. They brought suit under a wrongful death statute. Now, there were other suits that were brought for negligence, right, which is certainly something that happens on a daily basis when we talk about the medical profession. But there was one particular suit that talked about whether or not this would fall under a wrongful death definition. And the Alabama Supreme Court decided that, yes, frozen embryos in any form before being implanted into any uterus qualify for personhood. And because of that, IVF treatments and facilities and clinics closed and stopped offering those services to their patients because of that interpretation. And so, that is what we are trying to guard against, and we are trying to give some assurances to providers. So if you read Section 9 in conjunction with Section 10, and we should always endeavor under just basic principles of statutory construction to read statutes as a whole and to give meaning and effect to each and every term that we have. When you read those together, we are providing some provisions for those providers to ensure them that if they're engaging in their practice and they're not doing some of these other more nefarious things, that some sort of outside definition, like happened in Alabama, is not going to prohibit their practice here, and that families will still be able to access those services. When we talk about the personhood definition, this definition, and I would note, it says any fertilized human egg or human embryo that exists in any form before implantation in the uterus. This is directly on point as it relates to IVF to make sure that practitioners can do their jobs and people can access this care without the same ramifications that we saw occur within Alabama. So I think that that's something that I wanted to illustrate for this committee. And I also wanted to point out that within Section 9, in both Section 9, subsection 1 and section 2, when we talk about limiting liability, it is solely for the purpose, right, of providing or receiving goods or services related to IVF and assisted reproductive technology, solely because of damage to an embryo. Just by way of example, if you take an embryo from a frozen storage freezer, there is always a chance that one of them in thawing process may not make it. That's not due to negligence. That's not because a practitioner wasn't abiding by whatever the parameters are for their particular license, or that they engaged in medical malpractice. When it concerns IVF and when it concerns assistive reproductive technology, these sorts of things are inherent in the practice of that medicine. And so in order to provide assurances so that we do not lose those practitioners and so that people can continue to access this, we have to put into law some legal parameters to ensure that this exists. And that is exactly what subsection 9 is seeking to do. And when you read that in conjunction with subsection 10, this is designed to provide assurances to both providers and to patients and to families that this sort of healthcare is available to them. So I wanted to touch on a couple of those things. I want to thank this committee for the discussion today, and for everyone who I think was brave enough to talk about something that I think, and I hope in the future there is not the sort of stigma and sometimes shame that comes with that. The difficult decisions about whether and how to have a family, and all of the different challenges that come along with that, I think are exceedingly personal. But when things don't go as planned, can feel somehow as though you have failed. These families have not failed. These moms and dads have not failed. And we, I think, as a body, owe it to them to provide some sort of ability for them to seek that, right? And to build and grow that family. If we believe in that, then this is the kind of bill that we should seek to pass and make sure we're doing the policy in the right way. But there's nothing about this bill that is doing anything other than providing some assurances and coverages for those families who have found difficulty along the way. And I just really want to thank everyone who has managed to come up and share their stories and be so willing to be front-facing on this and educate all of us about what sometimes can feel very challenging, but I think, interestingly enough, is more common than we think. And so I want to thank you for your time. Thank you for allowing me the opportunity to address you. And with that, Mr. Chair, I will turn off my microphone.
Thank you so much for that presentation, and thank you so much for everyone that came out today. I'm going to go ahead and close the hearing on this bill and move on to our last agenda item, which is public comment. So if you would like to provide public comment at this time, you may come forward. Again, it's a 2-minute limit, and it can't refer to any of the agenda items that we talked to today. Is there anyone here in Carson City? Anyone in Las Vegas? AVH, is there anyone online?
To participate in public comment, please press star 9 on your phone to take your place in the queue. Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. That concludes the work of today's meeting. We'll see everyone next Tuesday with plenty more bills, and a meeting is now adjourned. Thank you so much.